Welcome to the COVID-19 video series. My name is Leah Hampson-Yoke. I'm a PA in infectious disease at the Fred Hutch Cancer Center and the University of Washington. In the past videos, we've been talking about treatment, we've been talking about testing, and we've been understanding COVID-19 and our general health. Now we're going to take a dive into shared decision-making around COVID-19 care. What we know is that while the risk of COVID-19, particularly in severity and hospitalization, has decreased with time, it is still a public health risk. We also know that there's a seasonality to COVID-19, meaning that there are times when the virus can replicate more and surge in our communities in the winter and the spring. We also know that vaccination greatly reduces the risk of hospitalization and/or severe COVID in our patient population. However, there's often resistance to vaccination or even COVID-19 testing. So this video will talk about some of those shared decision-making options. In my own practice, I have seen many patients resistant to conversation about COVID-19. People often bring up things like, I don't want to get vaccinated. I've been vaccinated last year and it didn't work and I got COVID. Other common concerns are, do I have to really get this every single year? I'm sure you've heard these in your rooms, and I want to talk about those a little bit more. When I think about how I counsel for COVID treatment and COVID testing and even COVID vaccination, I like to think about who's in front of me and the risk factors they might have. Risk factors that include patients that are greater than 50, patients who have different comorbidities, patients who are immunocompromised. In fact, some of these risk factors for severe COVID mirror some of the post-COVID risk factors that we talked about in earlier videos. But these are the patients that I'm most concerned about developing severe COVID. These are the patients I'm most concerned about going to the hospital, and these are the patients I'm really going to counsel about treatment and vaccination. When I think about how I help a patient come to a shared decision with me, I like to use the American Academy of Family Physicians SHARE model. The SHARE model includes seeking patient participation, helping the patient explore and compare treatment options, assessing patient values and preferences, reaching a decision with the patient, and evaluating the patient's decision. I've encountered many patients who have had both treatment and vaccination hesitancy. Using the SHARE model, understanding their perspective, helping them understand my perspective, giving them data, and reaching a decision together ultimately allows for the patient both to trust you as their provider, but also allows awareness for the concern about COVID-19, particularly in patients at risk for severe COVID and/or hospitalization. When we engage in these conversations with our patients around COVID-19 treatment, testing, and vaccination, we're helping them understand how important it is for safety, maybe not just for them and their family, but for those around them, and also an understanding of the public health implications that happen with COVID-19. It's in these conversations that we as providers are doing a great service by giving them information, but also pausing and understanding what their concerns are. And it's through this that we can develop a relationship and help them make their health goals.